FIG grant funding has enabled us to build our network. I've been able to meet people across the country in similar sized agencies, gathering best practices. The FIG infrastructure has curated some of these resources for us through websites, and again, the connections I've made. Also, they have a formal program for me to obtain a mentor who runs quality improvement for their state. I asked for that, that's exactly what I got, and I feel like I got the best person on the planet to help me learn and also adopt new QI tools to help us have a bigger impact. The biggest, quickest win we have so far with these new QI tools, which helps us not only run projects, but how to track those in a system where everyone can see to give us more recognition and reinforcement of this new higher QI mindset. Biggest outcome we have so far is better access to behavioral health care. And that's one of our big growing areas in our agency. And I call this a medium-sized project, but the impact has been huge. By working through our call center and our therapist and our front desk and the whole scheduling system, we had some bottlenecks. And by making some changes through a structured QI project that is, this QI template is new for us, we've been able to streamline our call center process as well as the folks at our front desk that greet patients. That's enabled us to have one source of scheduling, but also we've got some AI tools in development that we're testing in our clinic, soon to be in behavioral health, to predict when patients are going to not show up for their scheduled appointment. This is going to help us to keep these providers busy when they're on schedule, being able to serve as many people as they can. So it's already enabled us to serve more patients with the same number of staff, and I see that just increasing as we go along. Tabitha is our behavioral health manager. She tells us today we had a non-established Spanish-speaking patient who needed behavioral health services. We met with them, did a brief intervention, and scheduled them with Norma, our only Spanish-speaking BH provider, that's behavioral health, for next week. This teamwork and communication between departments is commendable. She also tells us that Norma is now booking out to early October, that's about 3 weeks from now. Prior to this project taking place, her backlog was at least 3 months to see a brand new patient. So this is a huge impact on folks, especially for this population that needs the help. One more story from Cassandra, who's our clinical office supervisor. We continue to have success with the call center scheduling last-minute cancellations. There is currently no wait list for behavioral health. All patients have been placed so far. This is a huge improvement from where we were just a few weeks ago with this project.